Everyone, and welcome to today's webinar, Cancer Survivorship, Empowering Cancer Survivors to Self-Advocate Through the Use of Survivorship Care Plans. My name is Marietta Factora, and I will be today's host. I work at the Asian and Pacific Islander American Health Forum, where I help to respond to technical assistance requests related to cancer work, and I lead the cancer work under our partnership with Appeal and the RAISE Network. We will hear from today's speakers shortly. They are Dr. Furjen Deng, the National Advisory Council Chair of the Asian and Pacific Islander National Cancer Survivors Network, and Joanne Lee, Program Manager at the Asian Pacific Partners for Empowerment, Advocacy, and Leadership, also known by their acronym APPEAL. Before we start with the webinar, I'd like to go over a little bit of housekeeping. So on your screen, you should be able to see the control panel on your desktop. After a few seconds, that control panel is automatically going to collapse, and your screen will only show a grab tab displayed. So you can use the double arrows at the very top to open and close that control panel. So please use the questions panel to type in any questions that you may have throughout the presentation. We will be collecting those questions, and at the end we'll have time for Q&A. Later on today, we will email the presentation slides along with the link to the evaluation, and in addition, this webinar will be recorded and accessed on the Health Forum YouTube channel. For those of you who may have missed the introduction, my name again is Marietta Factora, and I am today's host. I am the Policy Advocacy and Network Development Associate at the Asian and Pacific Islander American Health Forum, where one of my roles is to respond to TA requests related to cancer. At the Health Forum, our mission is to influence policy, mobilize communities, and strengthen programs and organizations to improve the health of Asian Americans, Native Hawaiians, and Pacific Islanders. So here's a quick overview of today's webinar. We will first start with what is cancer survivorship. I will provide an introduction and background of the Asian and Pacific Islander National Cancer Survivors Network. Dr. Furjen Deng will then share her cancer survivorship story. I will then provide information on what cancer survivorship care plans are. Joanne Lee will then provide an introduction to the RAISE network, and then finally the remaining time will be for questions. So what is cancer survivorship? According to the National Coalition for Cancer Survivorship, cancer survivorship describes living with, through, and beyond a cancer diagnosis. The definition was later expanded to include family, friends, and caregivers who are impacted by cancer diagnosis in any way. As of January 1st, 2016, there were more than 15.5 million cancer survivors in the United States alone. According to the American Cancer Society's Cancer Treatment and Survivorship Facts and Figures of 2016, it is projected that the population of cancer survivors in the U.S. will increase to nearly 20 million by the year 2026. One network that is an important resource to cancer survivors is the Asian and Pacific Islander National Cancer Survivors Network. They can also be known by their acronym, APNCSN. They are a network of cancer survivors, their family members, healthcare providers, researchers, health advocates, community members, and organizations concerned about cancer survivorship in the Asian American, Native Hawaiian, and Pacific Islander communities. The network's mission is to dispel myths, reduce disparities, and provide hope. APNCSN has been a good resource for cancer survivors since it was founded in 1998. The network links AAs and NHPIs with critical resources, including connections to other cancer survivors, referrals to cancer support and survivorship resources, and access to multilingual cancer materials. So here are two photos of the network's co-founders, Susan Shinagawa and the late Reverend Chong. Many of you may be familiar with Susan Shinagawa's story, as she has shared it many times as an advocate. In 1991, she found a lump in her breast, had a mammogram that turned out to be negative, and a sonogram that showed that the lump was a solid mass. Her doctor, he refused to perform a biopsy of the lump of the breast, and to quote the doctor, he said, "You're too young to have cancer. You have no history of cancer in your family, and besides, Asian women don't get breast cancer." Susan, she advocated for herself, and she sought for a second opinion. When the doctor then performed a biopsy, it turned out that the mass was actually surrounded by fat, and so they said that she didn't have breast cancer. But then the following day, she received a call that did indeed say that she had breast cancer. Susan decided to have a mastectomy done, and then when she searched for support groups, she found that there were no AA and NHPI survivors at those groups. So what she decided to do was to become a cancer advocate for our communities. In 1998, Susan Shinagawa co-founded the Asian and Pacific Islander National Cancer Survivors Network with former Health Forum board member, the late Reverend Chong, who suffered from nasopharyngeal cancer. Reverend Chong was a 35-year cancer survivor before his passing in the year 2008. So what are some of the cancer health disparities in our communities? Cancer is the leading cause of death for Asian Americans, Native Hawaiians, and Pacific Islanders. AAs and NHPIs experience higher rates of cancer than other racial groups. For example, Samoan women experience stomach cancer 4.8 times more than other racial groups, and uterine cancer 3.3 times more than other racial groups. AAs and NHPIs continue to experience the lowest screening rates and are less likely to be diagnosed with cancer at a localized stage. Some of the reasons for this could include lack of health coverage and access, lack of linguistically and culturally competent health care, and cultural beliefs that complicate communicating with providers. Here are another few beautiful photos of cancer survivors from the book called The Book of Hope, Stories of Healing to Honor Asian American and Pacific Islander Cancer Survivors. If any of you are interested in getting a copy of the Book of Hope, you can contact me. My contact information will be on the last slide of this presentation, or you can also go to www.apiahf.org and download a copy. So according to American Cancer Society's Cancer Treatment and Survivorship Facts and Figures of 2016, it has been projected that an estimated 57,740 of the new cancer cases this year are expected to be diagnosed among AAs and NHPIs. Recognizing these numbers, it makes it even more critical that we are talking about survivorship among our communities during talks, presentations, and webinars like today's. It is my privilege to introduce my first presenter, Dr. Furjen Deng. Dr. Deng is the National Advisory Council for the Asian and Pacific Islander National Cancer Survivors Network. She is also an advisor for the Light and Salt Association's Cancer Support Network, a professor in the Department of Sociology at Sam Houston State University, and last but not least, she is a 14-year stage 2 breast cancer survivor. Furjen, thank you for joining us, and I will go ahead and transition this to you so that you can share your cancer survivorship story.
Okay, thank you, Marina. Such a long welcome for me. And hello, everyone. Really happy, and it's my pleasure to be able to share my story here. Like that first slide said, you know, the times really fly too fast because I couldn't believe it's almost my 14th and 15th years of since my diagnosis. So in retrospect, I try to move my life back to 14 years ago. That's before diagnosis. And I would say, you know, that time as a young woman, not really about age 42, I was busy. I would say my life was busy because of my job, and also I have 2 kids, minor, very minor. My daughter at that time was age 4th grader, and my son just went to attend the 1st grade. So life is pretty busy between my job and also my family life. And then I remember it's about 2002, in the summertime. I think that right after I finished my spring semester's coursework, and I started to feel not very well. And that time I was just promoted to become a full professor. So I feel I was so thrilled. Finally, I have another milestone in my professional career. But I also, same time, I start to feel not very well. So I think maybe I should start to take care of myself. And at the same time, I started to lose weight. And after 2 months, the doctor could not find anything. And then one day, I remember in July, I felt a lump in my breast. And that time, first time, because I just had my mammograms done, the first mammogram done in a year before that date. So I did not really assume that would be very bad. But I thought, anytime you find something, you better check with your gynecologist. So I went to my gynecologist who delivered my 2 babies, and which I feel like I can trust. And I said, hey, I have something in my left breast. Do I need to worry about that? And he did a physical exam, and also I think that after that I said, well, do I need to do a mammogram again? He told me exactly what the Susan Shinagawa received from her doctors. And I remember my doctor oncologist told me, say, well, you are young, you are Asian woman, and also you don't have a family history, okay, of breast cancer. So I think that is a benign. I don't think you need to worry about that. And you just go home and take a vitamin E, and that's it. So that time I still believe the doctors, okay, because I have a trust my doctor, because I'm not a medical doctor, so I'm sure that they have lots of experience to tell me why they have this conclusion. So I'm trying to move on my life after that conversation with my gynecologist. But after 2 months, I started to do a physical therapy. And after the physical therapies, and then I have a sharp pain from my the breast, the left breast. And after several weeks, the pain just won't go away. And guess what? I never thought about second opinion during that time. And one day, a girlfriend of mine, I think she probably heard many times I complained the hurts from my breast. And she said, you know what, why don't you get a second opinion? And you have insurance, right? The second opinion is free. Why don't you go to get another check with another gynecologist? Why you are such, trust for your first gynecologist? And I listened. Yeah, that suddenly just kind of woke me out. Hey, yes, I can get a second opinion plus the insurance will pay it. So I went to the second opinion. Guess what? The Friday I went there, and then Monday the second gynecologist ordered me to do a mammogram right away. Because this one day he said, anything in your woman's breast, you need to figure out what is that. So Monday I went to the local hospital for mammogram, and then afternoon biopsy right away. The next day I was diagnosed with stage 2 breast cancer. So that was really a shock, because first of all, I was age 42. You always think about somebody else get the cancer. You are not the one going to get the cancer, right? And plus I have 2 young kids. Okay, so I wasn't prepared for the diagnosis mentally or knowledge, because that time I really don't know anything about cancer, especially breast cancer. All I know is 2 breast cancers. At the same time, I think my family, my husband, nobody was ready for this diagnosis. So, but luckily, I live in the Houston, so we have a medical centers, the MD Anderson Cancer Center. So that time, I think the night I was diagnosed, my neighbor was very nice, introduced me another survivor, breast cancer survivor. And we have a long talk for about 2 hours. That's really helped. And then so I was able to follow her advice and went to MD Anderson for my breast cancer treatment. So after once I was connected with MD Anderson, the treatment just started right away. Okay, so certainly during the so I had the 6 months of the chemo and the surgery, and then 1 month, 6 weeks of radiation for about total 9 months treatment. During the entire 9 months treatment, I would say the side effect was tough, and also the treatment. You have to drive to MD Anderson because I live in about 1 hour away. So for example, radiation is almost every day. But I think during the entire journey, okay, of course the side effects it was tough. Okay, it's not something you have to do every time. Once in a while, you just try to do it once in your life. That's it. But I think there also something is missing in that cancer journey. I remember during the treatment, I was a fear. I think the fear of the cancer, fear of the outcome, and the fear of the anything. So that time I remember I always asked my family or my friend. I know that my family members were very supportive. My friend trying to support me, but none of them really can convince me until I told them, go find someone who had been this process. Okay, especially someone I can talk, because I'm not a native English speaker. So I'm trying to go find someone speak my language, which is Mandarin. And I remember my family was very hard trying to find those people. So I have a survivor. Finally, they connect me to people in New York, people in North Carolina, people in California. And that really helped me because, I saw those people went through at the same stage of the breast cancer like me, the same treatment, and they were, they have been through it and they were okay. And that is really something I don't think my medical team can deliver. And I have a wonderful medical team, okay? My doctors, their supporting nurses, PA, everything, they were wonderful. But like I say, they cannot fill in that gap, okay, into my fear about the cancer outcome. And those survivors really helped me, okay? So I'm lucky, were able to connect with some of the survivors at the same time, and then I finished my treatment. And it turned out the treatment was pretty good. The outcome, after my surgery, they said they couldn't find any cancer residuals here. So suddenly, after 9 months of treatment, and my post-treatment has started. And this is, guess what? Even my treatment outcome was great, okay? In fact, my oncologist trying to tell me, it looks great, okay? Because the clean, okay, the complete response for my chemo treatments. But guess what? This is, life actually was starting another scary again. You know why? Because during the treatment, I feel like I have a 24-hour care by my medical team. So if something's wrong, I can call them. I can email them. Do I need to pay attention to this one? Is this a side effect or is there something else I need to watch? But after treatment, they just told me, yes, you finished. And then no survivorship care plan. And I remember all I saw is the schedule. You're going to come back to see me 3 months. You're going to come back to see me after, 6 months, after 1 year. And I have no clue, nothing. So I think this is kind of another scary because I feel like I was my own again, okay? And so in other words, that's why I started to join the advocacy work, because if the cancer journey is not just like a diagnosis, the treatment, I think also is post-treatment. The survivorship should include it even after treatment, especially when you heard the previous slide. They are almost 15 million of the cancer survivors, and we expect these people are going to continue to increase. So there are lots and lots of I think the cancer survivors just after the treatment, and they just have no clue what's going on. Okay, and also that's why I become a volunteer, because I feel like if I can help out, especially other cancer survivors, newly diagnosed cancer patients. And very often, sometimes we don't have to do anything, just give them a talk, give them a call, and even just be present in front of that person. And they would tell me, wow, if you can survive, okay, I'm sure I can survive this treatment. And also the worst thing, I would say the worst thing a cancer patient going to have is they fight the disease alone. They go through the treatment by themselves and no support. So I think that's another reason drive give me the motivation, want to first become a volunteer. After I think probably about 2 or 3 years, and after my treatment, and I feel like my strength, I gained some of my strength back, and I started to be volunteer at the Lion Soul Association. And the reason I chose the Lion Soul Association because I found out there are lots of other ministry support group, okay, either at MD Anderson or at the American Cancer Society, but they don't speak the language. So I was thinking, given my educational background, if I still need someone who to share my same culture, speak someone with the same culture, the same language background, and I'm sure there are lots of immigrants, okay, especially like in Houston area, they were almost 70 or 80% of the like a Chinese American or Asian American, they are first generation of immigrants. So how are those people, if they are diagnosed with cancer, how they are going to connect with those resources? So that's why I become a volunteer and become an advocate for one of local Chinese cancer support groups. And I think this is very important because the advocacy work is not only just for cancer patient and caregiver, but also for the community too. Because the community, like when I was diagnosed, like I said, I really don't have the knowledge, anything, in terms of treatment, in terms of survivorship about the cancer. I always tell people, if I had the knowledge, like the currently I have, the very confidence I have now, when I was diagnosed, I think I will not cry that much for the first 2 months after my diagnosis. Okay, so I think this is very important. Sometimes, people just, like I said, nobody thought about, you're going to have a cancer. Cancer is always somebody else's disease. So by the time the diagnosis, to you, I think pretty much lots of people, they're just not prepared. Psychologically, physically, sometimes even financially, they are not prepared because many of them probably no insurance. Or even they have insurance, but they are HMO, underinsured. They want to go to the treatment center, they want to go, they couldn't go. Or even they don't speak the language, okay, to go. Even their insurance can take them to the medical centers, but they don't have the language to go there. So I think there are lots of need for the cancer patient once they are diagnosed. So for the community-wise, they also need to know where are those resources? How can we help our members who are diagnosed with the cancer? So I think this is just part of my journey, and I'm very happy to share with everyone. And also, thank you for the opportunity. Hi, Merida. I think I'm finished.
Thank you, Furjen. I actually have a few questions to ask you. So do you happen to have any advice for someone that's finishing treatment?
My advice is definitely, today is different. Do you know what? I think my diagnosis was, my treatment finished about 14 years ago. And I know that time they already have lots of information coming out from internet, right? But today we have not only internet, especially the immigrant community, you have the text message, you have like a WeChat and the Line. And you have information coming from all over the places, different directions. So my advice to the cancer patient, especially after they finish their treatment, I would say, first one, look at yourself, okay? And you survive. That's tough, okay? You survive, and now be strong. And then sometime you have to be wise, okay? You have to be wise. Continue to work with your medical team, okay? Because they are still the one have the most of the knowledge. But at the same time, try to be nice to yourself and also be alert. Sometimes the information you should, watch, you should listen, take in, but some of the information, there are lots and lots of, I would say, it's very misleading information out there. And I would say try not to listen to that. And the first one, just to take good care of yourself. And then if it's something you want to do, I always tell people, first one, I couldn't believe I have 14 years, okay, after the diagnosis, okay? But just do whatever you want to do, because you don't know when your life will end, right? When the cancer will come back. But try to enjoy every minute you have. That's my advice.
Another question I have for Jen is, as a patient navigator, what has been your experience with cancer survivors post-treatment? For instance, have any of your patients, have they been offered survivorship care plans?
I would say, based on my understanding, no. The major hospital in Houston area, I don't think they have received that one. Like you talk about the survivorship care plan is like a organized one, right? Like a very a package. You know, they will know what they're going to do, what they are expected, right? My answer is no.
Okay, thank you. So I'm thinking like one key takeaway that I'm taking away from your story for Jen is that cancer survivors, they experience a lot of physical and psychological challenges, and that advocacy is very important. So I'm thinking that survivorship care plans can be seen as a tool that cancer survivors can use to self-advocate and to empower themselves.
Yes. Yes, I think definitely that's I think the function for the survivorship care plan, because I have talked to many survivors. They don't know what to do after, especially like what to eat, what not to eat, what should I do, what should I not do. So I think if there's a survivorship care plan, really empower them to know what to ask from their medical team and what do they expect. I think that really help them. You know.
Okay, so I'll move on to explain what a survivorship care plan is for those of you on the line that actually may not know. So keep calm, because I have a plan, basically a survivorship care plan. In 2005, the Institute of Medicine, the IOM, issued a report recommending that every cancer patient receive an individualized SCP, including a summary of the patient's treatment, as well as a plan for follow-up care to improve health and quality of life. However, since the American College of Surgeons Commission on Cancer mandated the implementation of SCP by 2015, they have since updated the scope and timing because of barriers to implementation by cancer programs. So the goal is by the end of this year, December 31st, 2016, a SCP will be provided to 25% of eligible patients who have completed treatment. By the end of next year, 12/31/17, 50%, and by the end of 2018, the goal is to provide a survivorship care plan to 75% of eligible patients who have completed treatment. So existing literature highlights many differences between follow-up care provided by oncologists and primary care providers. That's why survivorship care plans are so important. An SCP can be used to bridge and help improve communication between the cancer survivor and their care team. It can also help to empower the cancer survivor to take control of their situation and ask empowering questions. Just to name a few questions, these include, what treatment and drugs have I been given? What are some of the side effects? Do I need to seek up follow-up care? Can I get cancer again? What can I do to maintain my health and well-being? And finally, what support groups can I turn to? There are a few things that can be suggested to make survivorship care plans more successful. First of all, there's a lack of consensus on data to include in an SCP. So a gold standard for information collected would be very useful. Also, developing and reviewing an SCP is time intensive, so there should be reimbursement for time spent creating one. Also, increased physician-provider support, as well as increased institutional commitment. And last but not least, we need SCPs in language, since they are commonly provided in English and Spanish. Asian Americans, Native Hawaiians, and Pacific Islander cancer survivors have unique needs. Are survivorship care plans addressing Asian American and Native Hawaiian Pacific Islander survivor needs? So far, we aren't there yet. Our community's needs are not currently being met. Something that should happen is to provide survivorship care plans in language that can be read by survivors, as well as involve survivors in the development of survivorship care plans to increase cultural responsiveness and patient-centeredness. As a joint project with the RAISE Network, the Health Forum and APNCISN are developing cancer survivorship plan guidelines for Asian Americans, Native Hawaiians, and Pacific Islanders. Our goal is that they are patient-focused and will inform any healthcare system across the country. So part of the project was to have a team from the Health Forum and from the Asian and Pacific Islander National Cancer Survivors Network review four survivorship care plans listed on an assessment tool created to score the SCPs in the areas of utility, cultural responsiveness, and sociological responsiveness. We will be publishing a report with key recommendations and guidelines for providers using SCPs among the AA and NHPI communities. So here is a screenshot of the American Society of Clinical Oncology, or ASCO's, Survivorship Care Plan. This template meets the Commission on Cancer standard for SCPs, and it shows that, and studies show that it takes about 30 minutes to complete this template. Since the screenshot is a little small, I'm not sure if you can visualize everything that's on there, so I'll just cover a little bit of what you can see on this care plan. So the care plan includes general information about the patient, the names of their healthcare providers, a treatment summary including diagnosis, treatment, and familiar cancer risk assessment, a follow-up care plan, which includes a schedule of clinical visits, cancer surveillance, symptoms of recurrence, late and long-term effects, and last but not least, psychosocial concerns. So we've come up with a few recommendations after reviewing the 4 care plans using the assessment tool. A few of these recommendations are above. You translate survivorship care plans into AA and NHPI languages. SCPs for limited English proficient AA and NHPI survivors should be utilized with interpretation and culturally and linguistically appropriate navigators. SCPs need to be culturally competent and culturally sensitive. SCPs should be written in a way that is less technical and is simple to understand. And finally, the survivorship care plan should not be limited to being completed online. So by no means are our recommendations like the end of this list. For those in the audience who happen to have ideas that you'd like us to consider for developing guidelines for our communities, please go ahead and type it into GoToWebinar, or go ahead and contact any of us on the and let us know your information that you might be able to provide, and your ideas are very important to us. So I'd like to move on to my second presenter of the day. It is my pleasure to introduce Ms. Joanne Lee. Joanne works at the Asian Pacific Partners for Empowerment, Advocacy, and Leadership, also known as APPEAL, where she is a program manager for reaching Asian Americans and Pacific Islanders through innovative strategies to achieve equity in tobacco control and cancer prevention, the RAISE Network Project. I'd like to transition to Joanne to tell us more about the RAISE project.
Hi, Marietta, can you hear me?
Yes.
Okay, great. Thank you so much for inviting me to be a part of this webinar. I think the work that has been going on with the Cancer Survivors Network has just been amazing, and we're so happy to be a partner in that. So just to introduce a little bit about RAISE, Marietta, will you be advancing the slides for me? So a little bit about RAISE. So we are a network of national and local organizations that are working together to prevent and reduce tobacco use and other cancer-related disparities in our diverse Asian American, Native Hawaiian, and Pacific Islander communities. And we aim to accomplish our goals by using evidence-based public health models and strategies that are both community competent and population specific. Next slide, please. So who is RAISE? So currently we have a number of core partners that we have been working with, including the Health Forum. And as you can see, we have a number of national organizations and also a number of local organizations. And these organizations represent various groups, and you'll see that, and also geographically and ethnically as well. Next slide. And if you're interested in learning a little bit about how you can become involved, we're always looking for new connections. Please feel free to look at our website, raisewellness.org, see how you can become a member. And you can also follow us on our social media channels. We're on Facebook, Twitter, Instagram, and we have a wonderful library of videos on YouTube highlighting the work that each of our RAISE partners are doing. So I highly encourage you to check out those videos and see what we're up to. And of course on social media you can find our hashtag RaiseWellness, and you'll see various posts that have been posted by not only us but also our partners as well. So with that, I believe this is my little brief summary. I'd be happy to answer any questions if you have.
Thank you so much, Joanne. I'd also like to invite folks to become a member of APNCISN. You can go ahead and go to www.apiahf.org to join. And also please follow us on Facebook at facebook.com/APINCSN. So I'd like to take this time and address some of the questions. If you have any questions, please go ahead and type them into the question box. I see one question. So it says, what are the most important things that a cancer patient needs to know? Furjen, would you like to address that question?
Yeah, yes, okay. I think I mentioned a little bit earlier, I think the most important cancer patient need to know is find the support. Don't be afraid, or don't be shy. I know sometimes, you know, the AAPI population, people tend to see, you know, there's some cultural stigma, you know, sometimes still this kind of stigma toward the cancer. But I would say just go out and reach out if you need to. And if somebody in your network, for example, your co-workers, your church, also anybody can help you, I would say just let them do it. Let them come in, because the cancer, like I said, cancer is the whole family business, especially during the treatment. There are lots of needs. And also be yourself sometimes. The second one, I think also important, be yourself. And it's okay to say no, it's okay to say yes. Because sometimes there are people too over, some of your friends just too nice, over, right? Doing over, and then you have to keep constantly explaining, you know, and greet them. There are times you are just tired, you need a break. You say, I just had my chemo treatment and I need to be myself and to rest, and just tell people, please don't come, and when I'm ready, I will let you know. Yeah. That's my comment. And also don't forget, also continue to work with your medical team. Like I mentioned earlier, today there are lots of information out there from different directions, and sometimes they are not the evidence based. They are, and then I would say just be wise, as make an informed decision. And before you do that, collect the information, talk to your medical team, and then make a judgment, make a decision for that. That's my advice.
That's great advice, Furjen. Thank you. Another question to address is, where can an AAPI cancer patient or caregiver find support services?
Call you guys.
That's right.
I think that's one way to do it. Yeah, because you're going to give them the contact information, right?
Yes, it's going to be at the end of this presentation on the last slide.
Yeah, I think because I think the API CSN, they already have a network of a local organization, different organization, they speak different languages in, across the entire United States. So from there, they may be able to connect you to local, support organization. And then from there, there are some of the network of local community can help you. And also, I think talk to the social worker from your medical team, your hospital. Probably that's another way they can connect you to the need you need, the support resources you need. The only thing I'm kind of saying, you can try it, but there are lots of hospital resources. They don't have Asian language support information and also resources over there. So I think they may be limited, but I would say go ahead and try it. Yeah, you never know what they have.
Okay, I see a question for Joanne. The question is, are there others in the RAISE network that are working on cancer survivorship?
I believe that there are folks that are interested in that topic. However, I feel that the health forum specialty is really the survivorship piece. So I think it would help to, link perhaps to clinics that are looking to maybe expand their services a little bit in terms of supporting, especially, the low or the limited English fluent patients who might, need a little bit more assistance in navigating the healthcare system, especially in terms of when it comes to addressing their treatment. So, but I would say that you all are doing really amazing work and really bringing this to the forefront, and it really needs that to be highlighted for sure.
Thank you, Joanne. Another question that I see coming in are there different plans for different cancers? So I can address this question. Yes, there are different survivorship care plans for different cancers. In addition to different types of cancers, we also have survivorship care plans for specific age groups. So one reason why I use the ASCO template in this presentation is because it's a good survivorship care plan that actually is used for all cancers. And then I see one more question here. It says, what is the timing of delivery for an SCP? So through readings that I've read, it says that it should be within a year of diagnosis and no later than 3 months after completing treatment. Again, if there's anyone else who has any more questions, please go ahead and type them into the question box. Okay, I don't see any more coming in. So if you do happen to think of anything at a later time, please feel free to contact any of the three of us, Furjen, Joanne, or I. Again, at our contacts, they'll be on the very last slide of this presentation. So going on to key points, hopefully these three key points reside with you after having watched this webinar. One would be that Asian Americans and Native Hawaiian cancer survivors are often lost due to inconsistent communication and coordination. Advocacy is essential. Survivorship care plans can be effective tools for self-advocacy, empowerment, and consistency in care. And finally, although survivorship care plans can be useful, some aspects of the survivorship care plans need to be modified to be more inclusive of Asian American, Native Hawaiian, and Pacific Islander communities. Here's a list of some of the resources that we used for this presentation. And finally, here are our contacts. I would like to thank my presenters, Dr. Furjen Deng and Ms. Joanne Lee. I would also like to thank everyone who has participated in this webinar. Thank you so much and have a nice day.
Thank you.
Thank you.